Hi everyone, welcome to Hair Science Part 2. We are today going to talk about patterned hair loss in male and female. So, जब हम बहुत छोटे रहते हैं, like when we are still a human being is still in the formation phase in the uterus, तो तभी जब hair follicles, hair cells are forming, तो ऐसा देखा गया है that your hair, though completely like it is the same and it is on the scalp, इट हैज़ डिफरेंट ओरिजिन. यानी कि जो पीछे के हेयर है वो एक अलग ओरिजिन से आए हैं, जो सामने के हेयर है वो अलग ओरिजिन से आए हैं. दिस कुड बी वन ऑफ द रीजंस व्हाई हेयर लॉस एक पैटर्न में देखा जाता है, बिकॉज योर हेयर सेल्स आर रिस्पॉन्डिंग डिफरेंटली टू डिफरेंट स्टिम्युलस. वन ऑफ द अदर रीजंस इज दैट जो भी हॉर्मोन्स, जो भी स्ट्रेसर्स अपने बॉडी में हैं, दे हैव अ रिसेप्टर. एक रिसीविंग एक सेल होता है या एक रिसीविंग जीन रहता है अपने सेल्यूलर लेवल पे, जो कि इन हॉर्मोन्स को इनको रिसीव करके फिर सिग्नल्स जनरेट करता है. तो ऐसा कह सकते हैं दैट द लेवल ऑफ दिस रिसेप्टर्स फॉर डिफरेंट हॉर्मोन्स इज डिफरेंट इन द डिफरेंट स्काल्प रीजन्स. दैट इज वाई whenever there is a hormonal issue or whenever there is a nutritional issue or a stress issue, your hair is going to respond differently in different areas of the scalp. Now when we talk about male pattern hair loss, it is so common that almost everyone, about almost 90% of males are going to have certain temporal hairline recession, frontal baldness about the age of 40. And if you are predisposed to any kind of hair loss, whether it is a familial hair loss pattern, or you have an increased sensitivity to any of the hormones, then you are going to see a complete pattern of male hair loss, wherein ओनली जो ये पीछे के बाल है, जो ऑसिपिटल रिम कहते हैं, ओनली दे रिमेन प्रिजर्व्ड एंड रेस्ट ऑल ऑफ योर हेयर starts falling off. There is less hair growth and ultimately you reach the balding phase. Similarly, in females, there is a hair loss pattern called as the androgenetic hair loss or the female patterned hair loss. In this hair loss, there may not be a definite excess of androgenetic hormones or a definite excess of the male hormones, but your sensitivity at the follicle level for these hormones, यानी आपके body का reaction to the existing male hormones might increase, leading to what is called as the androgenetic alopecia or the female patterned hair loss. If this is the condition, then commonly आपने देखा होगा कि females का generally जो central partition रहता है, that central partition starts widening, and once the central partition starts widening, there is also a condition that your hair increases in length but won't grow in thickness. Plus you can understand that if you're combing or you're washing your hair, there is generally a more amount of hair, long hair that is being pulled out. So what clinically we can see is that is a hair pull test. जो doctors, अगर आप उनके clinic में जाओ कभी, तो they'll try to pull your hair, give a little tug to your hair in different quadrants, different areas of the scalp, and हर एक उस tug में कुछ ना कुछ hair बाहर आएगा. ऑल्सो अगर हम स्कैनिंग करते हैं इसी प्रकार मेल स्काल्प का अफेक्टेड फीमेल स्काल्प का, तो व्हाट वी नोटिस इज दैट जो हेयर का थिकनेस है वो पूरे हेयर थिकनेस भी सेम नहीं रहेगा, यूनिफॉर्म नहीं रहेगा. प्लस मेनी हेयर विल हैव अ वेरी वेरिएंट थिकनेस. सम विल बी वेरी स्मॉल, वेरी वेरी थिन, some will be thick and healthy. Now you just थिन आउट हेयर है, इसे क्या कहते हैं, तो इसे मिनिएचराइजेशन कहते हैं, यानी कि हेयर का छोटा हो जाना। और ये क्यों होता है? दिस इज बिकॉज ऑफ द एंड्रोजन एक्सेस और द reaction to androgens, which is causing miniaturization of hair and complete thinning. That is, the affected hair, it is going to fall off, it is going to get shed off. Plus जो follicle है, that doesn't remain healthy, it is getting replaced by fibrotic tissue, और ऐसा कुछ टिश्यू जो कि अभी हेयर वहां नहीं ग्रो कर सकता। इट इज सो दैट फॉलिकल जो पहले मे बी 3 या 4 हेयर ग्रो कर रहा था, वो अभी मुश्किल से सिर्फ एक अच्छा हेयर देगा। सो आप जान सकते हैं कि योर हेयर क्वांटिटी और द थिकनेस और द girth, the entire fullness of the scalp with that hair is going to get reduced to a very minimum. See, this is the temporal recession that I'm talking about. यहाँ से पूरा hairline पीछे चला जाता है, this that you can see. Plus there is some loss here in the crown, यहाँ का loss है, but यहाँ के जो बाल है वो preserved रह जाते हैं even till the end, और sometimes even the, जैसे कि यहाँ आप देख सकते हैं कि this entire occipital rim is preserved, but हेयर लॉस यहाँ से भी हुआ है, यहाँ पे भी हुआ है. सो दिस इज़ लाइक द वेरी एंड स्टेज ऑफ मेल पैटर्न हेयर लॉस. बट एंड देन अगर इतना ही रिम बचा है, देन इट बिकम्स वेरी डिफिकल्ट टू ट्रीट इट मेडिकली और इवन विद अ ट्रांसप्लांट, बिकॉज यहाँ से इनफ ग्राफ्ट्स भी नहीं मिल पाते टू इम्प्लांट. Okay, but we will talk about hair transplant in some next videos. Now see how a female pattern hair loss looks. This is the mid partition that is started widening. There is thinning you can see here. But अगर आप देखें तो उनका जो frontal line रहती है, जहाँ से बाल का forehead के बाद जहाँ से बाल आना चालू होता है, that generally remains preserved, whereas this part यहाँ से थिनिंग होगा एंड पार्टीशन वाइडनिंग चालू हो जाता है. सो कभी कभी ये 40s के बाद या 50s के बाद ये कभी कभी नोटिस नहीं होता, बिकॉज दे फील दैट इट इज़ जस्ट पार्टीशन है, इस वजह से हो रहा है, बट एक्चुअली इट इज़ अ फीमेल पैटर्न हेयर लॉस. सी लुक एट दीज टू पिक्चर्स ऑफ अ स्कैन. यहाँ अगर आप देख सकते हैं तो देर आर hair which are thick, then there are hair which is very very thin, like very very miniaturized. इसका almost thickness तो like 10-15 times less than this hair है. So this is a typical picture of a patterned hair loss, wherein various thickness hair है, empty follicles है, some short, very short hair which are almost like very affected. This is not going to grow. Whereas अगर यहाँ हम देखें तो this is a full follicle, all the hair are of a similar thickness, uniform diameter throughout its shaft. So this is a healthy looking scalp, whereas this is an affected scalp. This is what your doctor or your plastic surgeon or hair transplant physician, whoever they are going to tell you and explain to you what your scalp looks like. Now there are various methods of treating any kind of patterned hair loss, but there is no single treatment. Like many times patients approach me and they say that नहीं, हमको ये नहीं जमेगा, मुझे इंजेक्शंस नहीं जमेंगे, या मुझे स्ट्रेस होता ही है, या लाइफस्टाइल ऐसी ही है, या ये सीरम से मुझे इचिंग होता है. But what we have to understand is that it is like a 3 or 4 pronged approach. There, if we have to treat it, there are various levels that we have to target. Nutrition is one cause. Many of the times we see on Instagram, we see on social media interviews में that people are talking कि अरे हमने ये tablets launch किया है, and हमने ये syrup है, या this powder is there that you have to mix with milk, and it has all the good things that you need for your hair, and many celebrities or somebody, they're promoting it. But we have to understand that only nutrition is not going to work here. Okay, बिकॉज उसका कॉज ही वैसा नहीं है कि सिर्फ एक चीज उसको अफेक्ट करके ट्रीट कर सकता है. इट इज hair loss is being caused by multiple things at multiple levels. You have to target all of them. So nutrition is one of them. Nutrition is one of the, you can say that it forms the ground level, it forms the base work. You cannot build anything unless and until your base or your ground is very well firmly established. So nutrition and micronutrients are the main, but it is not the only thing. Then you have many other preparations that you have to spray or use on your scalp, जिसमें मिनॉक्सिडिल हुआ, फिनास्टेराइड हो सकता है, ड्यूटास्टेराइड हो सकता है. Then maybe there are multiple other non-minoxidil, non-finasteride formulations that are available nowadays, which have multiple agents, multiple growth factors, multiple plant-based actives that are going to improve your scalp health or are going to reduce the inflammation, and these have to be used for several weeks. Apart from this, now in order to give the follicle the stem cells, the growth factors, the ingredients in order to push hair growth, in order to push its thickness, you have to give certain injections at scalp level. फिर उसमें PRP हुआ, which is platelet rich plasma. It can be concentrated growth factors, it can be exosomes. The plus and minus of this and whether it suits you can be told better by looking at your scalp and by a doctor who's trained in this. But remember that one wonder thing does not work. You have to look at it from a complete, as a holistic picture, to improve hair and to improve it and maintain it over the time. So there is no wonder oil, wonder drug या फिर one solution for everyone. ऐसे क्रॉस सेक्शन में सबके लिए कुछ एक सोल्यूशन दे के नहीं बोल सकते कि हाँ ये चीज़ आ चुकी है मार्केट में और ये पूरी आपका प्रॉब्लम सॉल्व ही कर देगा. नहीं, ऐसा हो ही नहीं सकता, क्योंकि प्रॉब्लम जो है वो मल्टीपल लेवल्स पे है. So let's try understanding this more in detail, the treatment part more in detail in the third video. Bye bye.